nurse today. How are you feeling? And can you just confirm your first and last name and date of birth for me? Awesome. And then allergies? Penicillin? Okay, awesome. Alrighty. So is now an okay time for me to do a little bit of an assessment on you? Awesome. First, I'll just take a quick little listen to you.
And then totally accordingly from B1 to B6 and arms nice. Okay, now I've got your EKG stickers on. Okay, and I'm just gonna feel her color, and his color looks good. And then while I was down with the SPO2 monitoring, I was going to assess for edema and look for hitting edema and look bilaterally, also to see if there's any color differential.
Everything sounds clear, sounds how we like it to. Are you in any pain right now? A little bit? Okay. Do you want anything for the pain? No? And can you rate that out of 10 just so I can log it? Awesome. And then I'm going to grab a quick set of vitals on you as well. Blood pressure. Pulse ox. The other finger. Do it on. Go ahead and do it one more time. Awesome. And then I would get your temperature just under your tongue. Alrighty. And all of the vitals were within normal range, so that is good. And I'm just going to feel your pulses real quick.
Is it alright with you if I do a quick assessment on your child today? Okay. And what I'm doing basically.
Alrighty, and they are strong and equal. And then is it okay if I take a look at your breasts? Just look for any cracking or anything. Have you noticed, I know you've been breastfeeding, have you noticed any pain with them, or pain with the breastfeeding, any pain in your breast at all? No? Okay. If you do, let us know. How has the breastfeeding been going? Good? Okay, awesome. And then the nurse before said that you were wanting to pump for your baby in the NICU? Okay, great. So once I'm done with this assessment, I can go ahead and grab a pump and bring it in here and let you know how everything works and stuff like that. And I think that's a great idea. Breast milk can be super beneficial for the baby. It contains a lot of nutrients, so it would be great to get your baby in the NICU on that as well. Now I am going to do a fundal assessment, if that's okay. Alright, and when's the last time you went to the bathroom? Just recently? Okay, awesome. We like to have your bladder empty while we do that to make it more comfortable and more accurate. I'm going to lay you back. Alright, and then I'm just going to move your gown up.
You know what I mean? Like, it just makes you feel good. Like,
and then I'm also going to look at your abdomen while you're here and just take a listen. When was your last bowel movement? You haven't had one since delivery? That's okay. We will hopefully have a bowel movement soon. I'm just going to take a listen and make sure I'm hearing.
And then I can also do it locally.
And your bowel sounds are active in all 4 quadrants, so it seems like everything's working in there. It's just taking a little bit of time to come out. That is okay. The first one is usually pretty painful for people, I will say that. So if you would like some pain medicine at some point before that happens to kind of pre-medicate, we can do that. No, you're good? Okay. And then just like they were doing the fundal rubs upstairs, I'm going to have you breathe in and then breathe out. Alrighty, and uterus is firm, midline, one below umbilicus, so everything is great. And then I'm going to take a look at your C-section scar, and everything is looking good. I'm not seeing any signs of infection, any discharge, anything like that. And I'm gonna take a look at your perineum. It's a little bit swollen, but it looks like you're not bleeding too much. And then I would ask her to get into Sim's position to assess the laceration. For bleeding, just look at the overall appearance of that. I can't do that with the mannequin, but everything looks good. And it looks like your bleeding is pretty light now, which is awesome. So for bleeding, we get concerned if you're soaking through a pad in an hour, or you have clots that are bigger than the size of an egg. So if you see either of those, both when you're in the hospital or once you're at home, let us know. If you're at home, come in, because that could be a hemorrhage, so we don't want that. And then just like a little bit about just going to the bathroom and stuff. How has it been feeling? Any stinging, anything like that? Yeah, okay. So that's, again, very normal after birth. It's going to sting for just a little bit, just not feel super great. But we have the witch hazel pads, we have the dermaplast, we have ice that we have on that pad right now. So all of those things will help. So yes, and then I'm going to move on down to your legs. And uncover them. Alrighty, I'm going to feel for pulses here. And down here as well. And then I'm going to look for any edema. It looks like we don't have any edema. Are you feeling any calf pain at all? Nope? Okay, awesome. Because that could be a sign of a clot in your leg, so that's great. Some things we do to prevent clots, especially after C-section, is just like some walking around. So make sure you're walking a lot, moving around, and then the compression socks that they may have put on you upstairs. And yeah, just if you are feeling any calf pain, let us know, because that could be a sign. But I'm not seeing anything. And then I'm going to test for ice. Alright, and that side's good. And this side is good as well. So we just test for clonus because you have hypertension. And I'm going to test your reflexes here. If I could get your bracelet out of the way. And that one is normal reflexive. On this side as well.
So that's what I would always
Right, that one is normal reflexive as well. A couple of other education things. Just we like to recommend that you change your pad every time you use the restroom, just to help prevent any infection. And then yeah, just keep on breastfeeding the baby you have here, and I will get you the pump. Do you have any other questions for me at this time? No? Okay. Have you received or seen anything about the discharge videos? Yes. Okay. So yeah, we just have you watch all of those. So while you're waiting on us, you know, to get you ready for discharge, you can just keep watching those videos, work your way through them. If you have any questions, here is your call light. Anything else you need right now? No? Okay. Congratulations on your baby, and I'm sorry that it was kind of a rough delivery. I'll be back in a little bit to check on you.